people with ADHD, people with autism, people with kind of all of these like different learning disabilities. But neurodivergence actually also encompasses gifted people. So a lot of people who are gifted would be considered neurodivergent. So not all master plants are psychedelics. Some examples are coffee plant, cow plant, right? Think about what people will do to get their coffee. Think about what people will do and how they feel when they have chocolate, right? Tobacco is another example of
tobacco. Yeah.
The coca plant, right? Which
Cocaine.
is a deeply powerful and healing plant used in indigenous communities. Microdosing is sub-psychedelic dosing. That means that you get some of the benefits of the psychedelic, but without being altered in a way that would prevent you from doing your life.
Welcome back to the Smart I Heard Of podcast, your home for 1 cent solutions to $64,000 questions. I'm your host again today. My name is Dr. Scott Sherr. It's a pleasure to be back with all of you. Today, I had a really great guest on the podcast. Her name is Dr. Maya Shetreat. Maya is a friend and a colleague and a really fantastic lady. Here's a little bit of a bio on her. She is a neurologist, herbalist, urban farmer, ceremonialist, and author of The Dirt Cure and the newly released The Master Plant Experience, The Science, Safety, and Sacred Ceremony of Psychedelics. She's been featured on the New York Times, The Telegraph, NPR, Sky News, The Dr. Oz Show, and more. Dr. Maya created Quantum Drops, a vibrational master plant product that is safe, legal, and deeply transformative. She's also the founder of the Terrain Institute, where she offers a training for psychedelic-informed practitioners, as well as the upcoming Quantum Practitioner certification. And so Dr. Maya and I had a fantastic conversation during our podcast today. She really is an amazing lady. I mean, she started off as a pediatric neurologist and took that box and broke it very fast, and then created her own integrative practice. She now is a master plant extraordinaire. She knows everything about master plants. She has Indigenous experience. She has her own psychedelic experiences. We spoke about master plants in detail in the sense of neurodivergence and sensory gating. We also spoke about how these plants are being used in Indigenous cultures and how they're now being used in clinical practice with research. We talked about DMT research, talked about psychedelics with mystical experiences versus psychedelics without mystical experiences and the windows of opening for neuroplasticity and some of the potential positives there, and also maybe some of the potential dangers as well if there's no mystical experience as well. We then transition over to speak about Dr. Maya's certification and practitioner training and her framework of how to make sure that the body is prepared and how she prepares the body. I loved her analogy of the mitochondria with spaghetti and meatballs. I think you all will enjoy that one as well. Talked about the experience itself, of course, the psychedelic experience, but also the post-psychedelic experience and how people get in trouble when they go to IV ketamine clinics and don't get the preparation that they need. So this is a fantastic podcast to record. I really hope you enjoy this enjoyable and long and fun and exciting and meandering podcast with Dr. Maya Shetreat. Hello there, Maya. How are you?
I'm great.
It's nice to see you again. It's been some time. And I hate that it has to sometimes be on a podcast where I get to hang out with friends and colleagues and talk. But the benefit of that is that we get to ask and go into certain directions where you don't do that when you talk to somebody at a conference, for example, when you're just talking about a specific case or a specific thing that you're working on, whatever it might be. So, Dr. Maya Shetreat, thank you for being here with me. And to start off, you are not the average doctor by any means. So you started off as your main work outside of the medical system as an integrative pediatric neurologist. And if you could just give us a little background on this, because many people that are listening are clinicians themselves, and they're looking to come out of the box. And we're going to talk about how you don't have a box at all. There's no such thing as any sides to what you do. But initially there was. So we'll do a quick little background there on how you got to the world of integrative pediatrics, neurology, and then we'll go from there.
Yeah. So people usually think that I went into medicine, this very conventional person, and became integrative. But in fact, I went into medicine, at least in part, because I watched this Bill Moyer special called Healing and the Mind. This dates me because I don't know, I was probably in like college at the time. And they talked to like Deepak Chopra and, went to like all different interesting kinds of research labs. And one of the places that they went was this hospital where these doctors were treating a young girl with lupus, and she was reacting very badly to her meds. But if they stopped the meds, she'd have a flare of lupus. When they give her the meds, she'd go into renal failure. So they were in a lose-lose situation, and they thought, you know what? We're going to give her castor oil every time she gets her meds. And then eventually they stopped the meds, continued to give her castor oil, and she responded as if she were getting her meds, but with no renal failure. And they said, this is called psychoneuroimmunology. It's a new field of medicine. And I was like, whoa, this is what I want to do. I'm going to go do that. And I went to med school. I wrote an essay. I was an English major, so I guess it was a really good essay. And they accepted me. I wrote my essay about it, in fact. And then, in med school, I got married. Over the course of my training, I had my first, then my second, then my third kid. And, medical school.
Overachiever. Yep.
Medical school, I needed that little extra torture.
Of course. My wife as well. So we had 3 as well. Yeah.
It's something. It's definitely something to do that. It's sort of like no sleep and more no sleep.
Is it just that you're used to it, so it's okay? Or I don't know. I just think we're gluttons for punishment sometimes. Those of us that decide to go to medical school, I think.
It's definitely pretty masochistic for sure.
It is.
But, over the course of that, and I think a lot of people don't realize, education is a programming tool. It is an environment for programming. And the more education you have, the more programs you become. And my work is a lot now about deprogramming. So I've become really interested in that. But I really forgot all about psychoneuroimmunology. And I was, I'm studying neurology. I'm interested in plasticity in the brain. I mean, like I was going there, but I didn't really remember why. And then my son, my youngest son, got sick at a year of age. And he had these sort of asthma symptoms. We weren't sure what was going on. He had a developmental plateau or really even kind of a regression. And here I am, pediatric neurology fellow, watching my child having these symptoms that are very scary. And nobody was really paying attention to it. I'm taking him to my colleagues and saying, can you look at him? What do you think? Just he seems fine, and I'm like freaking out. And that really took me into this whole journey back into where I actually started, which was integrative medicine. And I'm looking at diet, I'm looking at gut flora. And this was long before I want to add, this was in, the cover of the New York Times and people were talking about the microbiome. This was not anything mainstream. Nobody was talking about it. It was really
early 2000s. What was it, early 2000s, or when was this starting?
Yeah, it was the early 2000s.
Right. Yeah.
And so maybe 2006.
Yeah. You and I went to medical school that time, right? They were talking about the gut as having only one thing, bacteria, to kill. And if you killed too many of them, you had to be on antibiotics because you would get something called C. diff. That's the only thing I think I learned about the microbiome in medical school.
Right. But it wasn't called the microbiome.
No, there was no word. There was no word for it.
Bacteria.
Yes, exactly. It was called bacteria. Yeah. There was we didn't know there was fungus or viruses or any other kinds of species either, right? So,
right. And of course, anything that was there was bad.
Yes. It was a very different frame. Okay. So your son was going through this process. And so you were rekindled in your real passion for what brought you into medical school in the first place.
Yeah, without realizing it, because I'm thinking, okay, I'm looking at all these possible ways to address what's going on with him. And of course, since nobody's helping me, I dive into the scientific literature where I find information about the gut-brain connection. I find information about food and how it can stimulate different kinds of responses in the body immunologically, and how that can affect the brain through the microglia. And so I'm very nerdy and I really love science. And so that was what I was taught to do, go into the scientific literature. And there it all was. But I think a lot of people who would have looked in the scientific literature would not have seen that, what I saw, right? Would not have made those connections. I think that, was my particular perspective and what I way back when had really awakened before going to med school. And I remember saying to, a family member, I said, you know what? I think I'm interested in integrative medicine. And she was like, you've always been interested in integrative medicine. That's why you went to med school. I was like, yeah. What? Like, right?
Yeah, I can totally relate to this. I don't think you know this, but so I'm the son of a chiropractor. And so my father was a chiropractor for many years. And I always thought going to medical school, I would find this amazing way to kind of bridge the gap between allopathic and alternative medicine. But I forgot about all that stuff too when I was in medical school. Like, maybe I'll be a radiologist and sit in a dark room and make $700,000 a year. Or I could be a dermatologist and I could look at skin for $1 million a year and have my own clinical practice. So it's interesting, right? Because medical school is this programming world and you're just in the thick of it with 150 other people just trying to get by from day to day. So I can totally resonate with forgetting and then remembering, right? And so how did you then, as a clinician, so did you finish your training obviously and as a neurologist and then you specialized in pediatric neurology from there? Is that what you did? And then from there did some integrative training, or how did you get sort of that way?
So I was already in my pediatric neurology fellowship at that point, and I became certified in adult and pediatric neurology.
Got it.
So pediatrics, adult neurology, and pediatric neurology. That's the training in order to become a pediatric neurologist. And I actually had been hired already because pediatric neurologists are not very easy to come by. I had been hired by this practice, this big multi-specialty practice that wanted a pediatric neurologist to build, a practice there. Mm-hmm. And little did they know that they were hiring an integrative pediatric neurologist, because when they hired me in my second year of fellowship, I didn't know that that's who I was. And I too, right? We get these ideas of empire. You're talking about what I would call empire, right? Like, dermatology, I'm going to make all this money, or radiology, right? And it's like not necessarily what you actually want, but you're like, I want to be important and make money and maybe not work too hard and whatever. And here I am thinking, I have 3 children. I'm in debt. I have to be a breadwinner in my family. And this big private practice wants to pay me a lot of money to come and build their pediatric neurology practice. Sure, I'll do that. And then I arrive to their doorstep all ready to change people's diet who have migraines and seizures and give them probiotics and fish oil and things that were totally, even giving vitamin D back when I first started. And this was not the Stone Ages. I mean, I'm not that old. I got reported by to the chief medical officer of like the local hospital because somebody didn't understand how to look at vitamin D labs. And so somebody I was treating, giving vitamin D, had high 125 dihydroxy, but was deficient, right? And they didn't know how to look at the labs. And I had to print out a paper and show them, how the person who reported me, the hospitalist, didn't understand how to look at the labs and what it meant. And, so it was an entry into the belly of the beast. And there I was. I described that year as like, it was a year and a half that I was there just about. And it was like miracle after miracle after miracle. I feel, in fact, that like somehow the universe was showing me how, like, the most miraculous recoveries I could possibly see to convince me and pull me out of my programming, right? To convince me that I needed to follow this path because there's so much pressure in the other direction, particularly in that practice. I mean, they do things like they do things. And at first, because I was the only pediatric neurologist, nobody really knew what I was doing exactly. No one was really looking over my shoulder, but then they were going to their pediatricians in the practice and they're like,
Yes.
oh, the doctor told me to stop eating dairy and gluten for a month, or the doctor put me on, fish oil. And they're like, the neurologist, and then instead of asking me, why did you recommend that? Do you have papers? And they started to obviously, feel threatened.
Right.
Like,
of course.
oh, he's this newfangled thinker doing these crazy things and so on. So it was definitely a journey. It was a journey.
Yeah. I mean, that's an amazing story because it's so obvious that conventional medicine is at least 20 years behind in general when it comes to being able to be on the forefront of cutting edge care. And as soon as you start bringing things into the box, like I'm impressed that you were able to do this so quickly in the sense that you started doing these things. It sounds like almost out of the gate, getting out of your fellowship and starting in practice, right? And integrating these things. And the challenge, I think, is that it's not your job to reprogram people, right? in the medical world, right? But it's our job to try to sometimes do the actual right thing, which is to help patients, right? That must have been really, really challenging for you. How did you navigate those relationships? I'm sure that's why you ended up having to leave after a year and a half.
Yeah. I mean, so I guess I'll back up a little and say my son, who had been so sick with, what looked like asthma and was, I guess, asthma, and had been on steroids and antibiotics and, albuterol and steroids and antibiotics and albuterol, somewhere in there, I found like inhaled glutathione and, started him on magnesium. And, I was finding my way in these sort of little ways. But ultimately the biggest change for him was stopping soy. He was allergic to soy and he was drinking soy milk. Because he had, had stomach issues with dairy way back when. And so here I am thinking like, oh, I'm giving him this healthy stuff. And within a week of stopping soy, 9 months of constant sickness and asthma attacks, that was forcing me to stay home with him while I'm in my medical training. Nobody is popular.
No.
And they can't come in because of their own illness or their child's illness. That is not a thing.
It's not a thing.
In medical training.
No, it's not.
I
can vouch for that.
Nobody's that friend.
Oh, God.
And so seeing this dramatic change in him, and P.S., that was after going to one of the top allergists in the country.
Of course.
Who basically told me I was a hysterical mother. And refused to test him for anything but peanuts because he's like, I know you're just going to come back about that and, try to get the testing. So let's just do it today. And I found a community allergist who tested him and his whole arm blew up with soy. And so how did I navigate being in this big practice as people kind of were very suspicious? Well, I fought at first. I wanted to teach people.
Right. Sure.
I wanted to show them, but they were really not interested. And eventually I couldn't dedicate myself to actually helping patients because it was so distracting to have all of this other negative kind of energy coming at me all the time. But interestingly, I left and a lot of patients who kind of followed me or stayed in touch with me told me that a lot of the pediatricians and the GI doctor, the peds GI doctor, started using probiotics, started using fish oil, started using magnesium, right? So my whole regimen that I would put all these people on became part of their prescribed supplement support. But it's like they couldn't have me there. They had to do it on their own and in their own way.
Yeah, it's so interesting, right? So most people that go into the integrated world aren't like us. They usually start off with something that happened to themselves or their kids, their siblings, somebody in their family that they had to help that conventional medicine couldn't help. And it's interesting you've had both, right? You had the initial feel of like, you want to do this even before going to medical school, and then having this with your son and going through the process. But most people have to figure it out themselves because the medical system is not there to really help people be healthy, right? We know that it's helped them to not be as sick. But it sounds like you were having some very miraculous kinds of things happen in this year and a half with patients that I'm sure some of those patients were seeing the other providers at the office. So that some of that must have stuck at least, which is cool.
Well, and that really taught me, I think, that it's not about convincing people. It's about demonstrating and kind of just how you yourself operate, right?
Yeah,
like
totally.
there's this feeling of like, I want to get everybody to agree with me, or I don't want to get people upset. And like, unfortunately, when you have this like behemoth, this whole system that, as you pointed out, is very slow to move, slow to change. I think 20 years behind is a generous.
I was being generous.
Very kind of you.
Thank
you. You're not going to convince everybody. You're not going to change it for everybody. You're not going to have everybody agree with you. So you have to be willing to do the right thing. And, within reason. Nobody's saying like shoot up the whole place, but, people learn by what's demonstrated.
Right. And what they see, right? So if you're doing the things in clinical practice, even if they don't like them per se, if they see that they're working, it's going to get infused into their practice in some ways, and even in their own families. So that's typically what happens first, is what I found, is that I will recommend certain things to patients, and all of a sudden these doctors are like, what happened to this person? They're feeling so much better. What'd you do to them? And I'm like, well, it wasn't very difficult. Just did like X, Y, Z. And I think you mentioned soy, for example, as a great one. Is like, it could be a very easy trick or trial. A trick. It's just a trial of like staying off of something for a month. And just, it's another funny thing you mentioned, is that like I saw my father doing this back in the 1980s. He would take people off of dairy and their asthma would get better. He'd take people off of dairy and then their back pain would get better. And I'd be like, they went to go see it as a chiropractor for your back, but then you took them off dairy and then their back. It was, it's a very strange thing for people that aren't in that world to see. But okay, so I think that's really cool. And I appreciate a little bit of background there, Maya, as I didn't know all that about you. That's why I wanted to ask. But when it comes to some topics that I think would be super cool for us to dive into, at least on the neurologic side, and then we can move here to some of the cool work you're doing with plants and everything else, and with practitioners. I hear a lot, and this is becoming a bigger issue now as well, with the word neurodivergence. And I wanted to dive into how you think about this as an integrative pediatric neurologist, and also you can even foreshadow in some of the work we're going to talk about with psychedelics and plants and things like that, because I think this is a big topic for you, and I know an interest for you as well.
Well, so, as a pediatric neurologist, my whole patient population was largely, not entirely, neurodivergent. And so, those are like my people, right? People with ADHD, people with autism, people with kind of all of these like different learning disabilities, sensory integration disorder, and some of the other more behavioral disorders. And I'm just identifying them the way we're taught about them, right?
Right.
But neurodivergence actually also encompasses gifted people. So a lot of people who are gifted would be considered neurodivergent. And, we pathologize this group of people. And that is actually not, let's say, in Indigenous society, what we would have done. Okay. In Indigenous society, these would actually all be considered people who are gifted, including people who had schizophrenia, right? Including people who had bipolar disorder, like things that we are like, oh my God, you have to treat this. And maybe it was because they didn't have good treatments, or maybe not, right? Maybe because there were people who actually would identify somebody, for example, who had a psychotic break, let's say in Yakutsk in Siberia, and in that, Indigenous community, and they would be trained and they would become a healer, a representative to communicate with the beyond for the community. And it was not like by any means an easy life, right? Or an easy job, but it was considered a gift. Right? And so my experience of working with neurodivergent people has been to really tap into their gifts and to also help parents and family members support and advocate for neurodivergent people in their family, right? Because there's a lot of right, this goes back to this programming system. Our educational system, starting in childhood and continuing on, is largely about obedience, largely about programming. And those two things are obviously, kind of hand in hand. So people who are neurodivergent definitely are out of the box people, and they interrupt a lot of this obedience training, right? And right, because they're these, square pegs trying to be stuffed into these, round holes. And so, for me, neurodivergent people are so intuitive, are so, right. They just have access to a whole set of different skills than other people do. And, for me, it's been a real, passion to support them and just, a lot of what I think I did in my practice was just reassuring parents and families that, this kid is going to be fine. Is going to do great. And, I just actually went to the bar mitzvah. I was invited to the bar mitzvah of a patient that I took care of since he's 1 year old. And now he's, 13. And I got to hear his little speech and see, this kid who's on the autism spectrum, just so animated and on stage. And his mother gave a speech basically saying, she kind of referenced that I told her he's going to be fine. He's going to do great.
Pardon the interruption. This episode is brought to you by Transcriptions, makers of precision dosed, pharmaceutical grade, and physician formulated formulas in the form of a buccal jerky. Check out TroZ. This is our comprehensive sleep solution. It'll help you feel sleepy, help you fall asleep, stay asleep, and wake up feeling rested. It has 8 different ingredients in there, all that are going to optimize your sleep, working on the GABA system, serotonin, melatonin, and also something called cordycepin, which is going to increase your deep sleep. Go to transcriptions.com, save 10% on your order by using code POD10 at checkout. Now back to the show. Right. Yeah. I think one thing that I always get interested in here with some of the sort of the ancient tribal understandings of neurodivergence is, do we have a sense, or maybe do you have an intuitive sense of the evolutionary reason for this? In the sense of, we have people that are becoming schizophrenic now. It's not very hypothetically, if you're looking at the obedience side, you're looking at the living in society side, like we in the 1940s and 50s, and even throughout Western culture, we've put these people in insane asylums and things like that, right? But do you have a sense, is it because they have these extra gifts that they gave these tribes more of an advantage in certain ways? Or do you have a sense of that?
Well, I won't answer it from an evolutionary standpoint, but
Okay.
I'll say, and I think we live in this society for a long time now, hundreds of years, that is very linear and material and rational. But this is not always the kind of society that humans have lived in.
Right.
And we don't have to go back to ancient times to see that. We actually were, until maybe like 400 or 500 years ago, a society that believed we were surrounded not by things, but by beings, right? Like everything was alive, right? And you don't have to be like an animist to believe it. You don't have to like say God is in everything to say that everything has beingness, right? And so that different way, that lens of seeing the world in which there is this sense of the invisible, this sense of the mystical. And this is very foundational to my work now with practitioners and and so on, and scientifically based for
Right.
people who feel nervous. As I say this, I think that I think that people who are neurodivergent have a greater capacity to perceive that which we don't easily perceive, right? And this kind of brings me to the topic of sensory gating,
Yes.
which is really the window of perception that exists in the cell. It's a scientific measure, right? We can actually test for sensory gating. It's done through, for example, evoked potentials. There's auditory evoked potentials. There's visual evoked potentials to diagnose things like MS, like schizophrenia. So in neurology, we send people for evoked potentials to sometimes support a diagnosis. That's actually a measure of sensory gating. But sensory gating also is a little more esoteric, right? It's our window of perception. Think about if you're you're in a crowded room, you hear your name across the room, right? Like you're going to tune in and hear as best you can what whoever that person or those people are saying that had to do with your name. That is the way we modulate our sensory gating. Some people walk around with much broader sensory gating, and I would argue a lot of those people are the innovators of society. They are the, brilliant scientists and the artists and the, inventors, right? I mean, they are the people who, if we do want to talk about it from an evolutionary standpoint, move society forward or expand the box, right, in society. And so we do know that people who are neurodivergent do have wider open sensory gating. And sometimes, right, if you're a baby, your sensory gating is absolutely open and it's not very modulatable. And, on the other end, right, like with schizophrenia, you can also have very wide open sensory gating and then interpretation issues, right, that might come up. But this is, I think, really fundamentally part of where the gifts lie in neurodivergence. It's just that our society is not very interested in supporting those gifts. We're more interested in, normalizing and the obedience.
Yeah, that's what I was going to say. Like the obedience of things. It doesn't fit well if you have neurodivergence and you're trying to sit in a lecture or like in a school with 35 other kids listening to a teacher. It's just not very possible. And I think also the sensory gating, I think of also too on the quote unquote sensitivity of kids in the sense of how sensitive somebody is, how much information is getting processed and how much overload they'll get one compared to the other. I can see this in my two oldest daughters. It's a very different level of sensory gating. My older one can take in or just be observing or be around her so much more material and she's okay. But my second is like, it's an overwhelming scenario to think about this as well. So I think this is a good transition now because now we've been talked about neurodivergence. We've talked about sensory gating a little bit on how all this has evolved for you to create, this world. You didn't create it, but the evolution for you into these worlds of master plants and how did you evolve into thinking about these in the settings of neurodivergence and sensory gating? And I'm sure there's other ways to get there. And then maybe we can talk about what a master plant is as well.
Well, so that brings me back to my youngest son again, who, at a year of age ended up, or, some months after that, ended up on his soy-free diet and, his whole supplement regimen. And, I ended up writing the book, The Dirt Cure, which was all about how I support kids and families to do things like diet and connect with the earth and all of that. And then fast forward 7 years, I discovered we had mold in our apartment, probably started around when he started with the asthma, interestingly. And I had to move out for 5 months. We had to gut certain parts of the apartment down to the studs. get rid of all of our upholstered furniture, clean it, afterwards with literal like toothbrushes on the door frames, the whole nine
Wow.
yards.
Mhm.
And we moved back in. And my son had been very sick, not with asthma, but with a whole kind of new set of symptoms. We moved out. He did better. We moved back in. And within 2 weeks, he had a seizure, a first-time seizure in the bathroom that had the epicenter of the mold, but had been gutted to the studs. There was absolutely no mold, nothing there. He was on a whole regimen. He was very well supported. And we moved back in and he had this event and it was very scary, obviously.
Of course.
I call this guy my muse, right? Because
Seems like it. Yeah.
teens are spiritual teachers always, I believe, but
They are.
but some, like to do the lessons a little more intensely than others.
Yes.
And I just, I'm holding him and I really knew in my body that, and I say that on purpose, right? Because it wasn't like rational. It wasn't like, oh, well, I've done this and I've done that. And right. I just knew like in my whole body that this wasn't something I had the tools to help. Like I was seeing people from all over the world at that time. I had people refer to me from China and from Germany and from Australia. And like, I was seeing people from all over the country, all over the world. I had some hubris, I would say, I can help anybody. Like, not like I could cure everybody, but, I definitely had a certain opinion that, I guess I needed to be humbled. And I think that is part of what life is about. Is letting yourself be humbled again and again and again. That's how you evolve and learn. And I just knew I was going to have to find a teacher. And I ended up finding this Indigenous teacher. And it's a long story how that happened. It's very like poetic. And, I got turned away and came back, got turned away, right? Like the way you would in like myth, right?
Sure.
And I took him to this conference where this fourth generation shaman, who was a PhD in ethnobotany, was doing healings. And she did a healing on him and a healing on me and a healing on my daughter. And we left so different. We had driven 6 hours to go to her. Coming back, we were just, I would say like 50% of the car ride back, we were just laughing. Like our whole our whole way of being felt different. We were just so light. And it was such an interesting experience because I wouldn't say, even though I think I was a sensitive person, I did perceive things. I did have auditory processing sensitivity and all of that. I wouldn't have said, oh, I sense energy, right? But you can feel when energy is so shifted like that.
Sure.
And I ended up saying, well, can I learn with you? I want to learn. She didn't do anything with psychedelics. She did plant cleaning. She did egg cleaning. She used a candle, and these are all things that I've studied since with her. And she said, yeah, I take a trip to Ecuador, to the rainforest, et cetera, And so I ended up some months later on this trip to a country I'd never been to, people I didn't know, language I didn't speak. And I thought we'd be learning about Indigenous approaches, which we did. And they happened to throw in a few master plant journeys while we were there, not advertised, not mentioned, just, tonight.
Surprise.
Got
it.
I know I wouldn't have gone if I thought that was a part of it.
Interesting. Okay. Yeah.
Mom of young kids.
Sure.
I was a doctor. I was not into that. Also, I had a lot of childhood trauma. Did I want to go be in the middle of the jungle doing some kind of who knows what? So no, I wouldn't have done that. But I was there. And I ended up having this very seminal experience with the San Pedro cactus that I think I've been unpacking for the more than decade since. Everything, and not intentionally. I mean, everything I've done working with master plants and psychedelics, I've done kicking and screaming. I'm always resistant. I'm not writing a book about this. And then, a month later, I'm like working on this book. I'm not going to train people in this. Like, a couple of months later, there I am. So plants do have this way of working with you. And, that does take me to the idea of what is a master plant, right?
Yes, please.
Question. Yeah. So master plants are what Indigenous communities, and of course, I don't speak for Indigenous communities, and not all Indigenous communities are homogeneous in any manner, but I'm sharing what has been kind of taught to me and is common among a number of Indigenous communities that I've worked with. Master plants are the term that they use for powerful plants that alter human consciousness and behavior and help us navigate the human experience. And they're called master plants, not psychedelics. They will laugh in your face if you use that term. Psychedelics, compounds, tools, they don't think about it that way. They say these are masters. They're master teachers transmitting ancient knowledge. And they refer to them as kin, like grandmother, grandfather, mother, father. And in their estimation, this is working with your spirit because, and this paradigm has been really transformative for me, right? Like over 10 years ago, I went to Ecuador and I learned all of this, that, they don't see physical health in these communities as being primary. Physical health is totally downstream from spiritual health.
Right.
Spiritual health comes from being in right relationship. And being in right relationship with yourself, with other people, with the land and, the beings on the land and ancestors and the invisible. That is what health is. And if you have physical symptoms, it's because you are very, very out of right relationship spiritually.
Right. And much more down the line. Pardon the interruption. This episode is brought to you by Health Optimization Medicine and Practice Association, a nonprofit organization training practitioners how to optimize health rather than treat disease. For this particular episode with Dr. Shetreat, check out the bioenergetics module. We talked about spaghetti and meatballs in this episode, your mitochondria, and bioenergetics is all about mitochondrial function. This is a deep dive in how you can clinically use testing, data, diet, lifestyle to optimize bioenergetics and mitochondrial function. Go to homehope.org, use code podcast10 to save 10% off on this module or any module of the essential certification. Now back to the show. Right. It's the spiritual side that starts the whole process, or energetic, depending on the framework. But so with master plants, I think it would be helpful for people to talk about some examples and the question of, are all of these classically psychedelic, or are they not typically, or do they have to be psychedelic to be in this category?
So not all master plants are psychedelics. Some examples are the coffee plant, cow plant, right? Like think about what people will do to get their coffee. Think about what people will do and how they feel when they have chocolate, right? So tobacco is another example of a
right.
master
Tobacco. Yeah. Yeah.
The coca plant, right? Which
Cocaine.
is a deeply powerful and healing plant used in Indigenous communities. When I was in Ecuador, in fact, luckily I had a friend who said, if you're at a high altitude and they offer you coca leaves, don't say no.
Right.
We'll really help you. And there I was, had altitude sickness. We were all like a mess. And someone gave me coca leaves to chew dry. And 3 minutes later, I was like ready to go hiking and the whole thing. But we, of course, think about the coca plant in a very different way in our society. And so, yes, master plants are not necessarily psychedelic, but all psychedelic plants are masters, right? And they don't have to be plants. It's flora, fauna, fungi. So when we talk about, let's say, psychedelic mushrooms, they fall under that category of master, right? Of master plant.
Got it. Okay. So it's funny you have that story about coca leaves. I have a similar one. Although it wasn't in that kind of experience. I was hiking the Inca Trail when I was in medical school with some friends, and the guides all gave us coca leaves to chew on and cocoa tea every time we stopped at a location. So it was helping with our altitude overall. I think that it's interesting. You mentioned a couple that people don't think about, like tobacco, for example,
Mhm.
coffee and cacao. These are very commonly used in ceremonial in ancient cultures, correct?
Yes. In fact, um, so in my opening lecture for our psychedelic informed practitioner program just this week, I actually asked the question of everybody, what does it mean to be human?
Hmm.
And my answer, my personal answer, everyone has an answer and there's no right or wrong. My answer was a story about tobacco, the lore of tobacco that I found when I was writing my book. And the lore goes, tobacco, the spirit of tobacco invented humans to honor tobacco.
Hmm. So that's the story told in some indigenous cultures, or
Yeah. So it
yeah.
turns out that tobacco is probably the most universally sacred plant, even in areas where it's not indigenous to that area, because it's spread and been passed around. Tobacco is the most sacred plant in indigenous culture around the world universally at this time. And
Didn't know that. Interesting.
yeah,
Yeah.
very, very profound, very interesting.
Yeah. So couple places I want to go from here, and you actually foreshadowed it just then, is that we're practitioners, Maya. Like, we're doctors. Like, what are we doing talking about master plants and how? Because there's a lot of us here that are listening, and myself included. Even a couple years ago, I don't think I would have had this conversation with you, even on, our podcast, the Smarter and Harder podcast, because worry about the legalities, worry about how do you recommend things to people. Like, what is the framework that you've created? You've been doing this for a long time in your own personal life and now your personal practice. Like, if you're a practitioner and thinking about this, and you don't have to give away your whole course or anything like that, of course, but more just in the sense of what's your framework here as a practitioner that's really interested in this work, really interested in understanding how they can start using some of these things in some way with their patients and clients, or at least referring their patients. Like, what is your framework on how you think about this?
So I think first and foremost, what I feel about everything I've been doing, writing my book and the events that I've done, looking at master plants and psychedelics, my training program, it's really, people are very, very interested and are doing these things, right? So, and it's not without risk. And, I'd like to talk a little bit about kind of benefits and challenges.
Of course. Yeah.
Just briefly, at least, so that people understand, like, both why I feel so passionately about talking about it from the benefit standpoint and the risk standpoint. To me, I don't see the point in being hush hush and letting these kind of stigmas persist, because it puts people at risk. Like, I have a friend whose son has autism, and he was having a lot of mood issues, and secretly he ordered ayahuasca off of the dark web and had an ayahuasca journey in his basement when nobody was home. This is not a good idea in general. Okay. I know there are people who think that's a great idea, but I myself, as a
No.
doctor
No.
and mother,
Yes.
and person who has worked with master plants in a number of ways, I don't think that's a great way to go into an experience. And there's a lot of risk involved with that. So,
Right.
and of course, all this research, right? Every major university in the world, and certainly in the US, has a whole research, if not, a whole department that's dedicated to psychedelics right now.
Right.
Across the board. And they are publishing day by day, week by week, very profound and very impressive research looking at one dose or two doses. And I always, include that it is with professional support before, during, and after. Okay. No
Right.
IRB is just going to be like, go get it off the dark web and take it in your parents' basement. So this is always with professional support before, during, and after. But for addiction, and I mean all kinds of addiction, very serious, impossible to recover from addiction, but even,
Right.
Tobacco and alcohol and things that are common and destructive to people. depression, major depression that has not responded to any other treatments, OCD, PTSD, traumatic brain injury, people who are dying, and are having terrible angst, depression, anxiety, and really suffering as they're facing, a fatal illness. The vast majority of those people who have gone into studies, and, one of the people I've interviewed and worked with is Tony Bosis, who runs that department at NYU. They had profound sense of peace that came along with this experience, a one-time experience where they were able to access the mystical. And that's a topic we can come back to. But here we have this very profound experience that can change a number of psychiatric and psychological and physical conditions. So now we're seeing dementia, chronic pain, and it's being looked at in autoimmunity, allergy, like severe kinds of conditions that, again, are just poorly treated by our system. We're seeing that macrodosing, right, these large journeys, or microdosing even, can actually increase plasticity, not just neuroplasticity, right? This isn't just for the brain. It isn't just for psychological or psychiatric or mental health. It's actually rewiring our cellular memories, right? It's rebooting our cellular memories. And so that's like the passion, right? That is the passion behind like what is possible.
Right. So before we get into the framework, I really appreciate you did that, because that is a great overall just encompassing like the ecosystem here, right? A couple of things just to note there to dig in before is on the microdosing side of things, if you can talk a little bit about that, because that's not as well understood, at least in the literature as I understand it, but it sounds like there's a lot of interesting things that are happening. There are certain of these master plans that you've seen the most promise from or with so far. We can talk about that a little bit, and then maybe touch a little bit more on the cellular memory piece too, because I think most people don't know what you mean there. And we've heard these conversations about it a little bit, but I think it'd be cool to kind of dig into that just a little bit.
Yeah, absolutely. So microdosing, right? The reason there isn't a lot of data on microdosing, there is some, and it's growing, is, as I understand it from my friends at Johns Hopkins, who have done a lot of the seminal research in psychedelics for now, decades, is because it's much easier, believe it or not, to get approval from an IRB who's going to approve this research as being safe and ethical, to give people a psychedelic that is going to have a 5 to 7 hour experience monitored in a, clinical setting with the doctor there and all of the equipment and, et cetera. Then make sure they're back to themselves, safe, et cetera, and send them home. Microdosing is sub-psychedelic dosing. That means that you get some of the benefits of the psychedelic, but without being altered in a way that would prevent you from doing your life, going to work, taking care of your kids, going to the grocery store, the things that we need to do. It doesn't take you out of commission. So most people are not going to come and take a microdose in a clinical setting and just sit there, not having any experience and just being like, okay, when can I leave? Right.
Right.
So it's a lot harder to get IRB approval as we're kind of decriminalizing and or legalizing and or medicalizing, right? This whole process. I think that microdosing is going to end up being the real game changer in our society, more so than macrodosing. I definitely think bigger dosing can be absolutely life-saving. It is absolutely life-saving. And for some people, I don't think it's for everybody, or at least not everybody all of the time.
Sure.
But I think it would be actually criminal to prevent people who are deeply suffering from having a treatment that in one or two experiences could totally reboot their entire lives. Like,
Right.
why would we hold that back from people? And, the answer, of course, goes to this idea of the cellular memory and what can happen, right? So the way I'm going to talk about cellular memory is to just talk about childhood trauma for a moment. And most of us now know about, these adverse childhood events, ACEs. And that ACEs, these childhood events, can actually, depending on, how severe and how many and what your ACE score is and all of this, it actually changes the structure of your tissue, of your brain pathways. These are things we can see on MRI and fMRI and in a number of other ways.
Mm-hmm.
So we know that our experiences change our bodies, right? And what that really means is that our cells are intelligent and they understand a lot of languages. They understand physical insult or instigators, and they also understand mental and emotional and maybe even spiritual instigators as well, right?
Mm-hmm.
They understand all of those languages, but then the way they behave, it comes out, physically and mentally, right? It expresses that way.
Mm-hmm.
And the reason that childhood trauma is so different than, let's say, trauma we might experience later in life. And, now we also know trauma is not what happens to us, but it's how it embeds in us, right? Is because we have these window periods of plasticity,
right,
in our early years of life that we don't have later on, unless we take psychedelics or in a few other instances.
What's that window called again? There's a name for that window.
Critical periods of plasticity.
That's it. Critical periods. Yes. Okay. So so that's one way we can open up these potential windows that were closed to us many years ago. Okay. Gotcha. So this cellular memory, and we can reopen these potential windows when we were younger using things like psychedelics. One thing that I'm interested in before we get to your framework is when it comes to the emphasis that a lot of these studies are going now on trying to give you the experience of the drug without it being psychedelic, for example. So a lot of the emphasis, a lot of these companies is like, we want to give you the benefits of being on one of these master plants or a derivative thereof, because you can patent it if you can have a derivative of it. But we don't want you to have this psychedelic experience. Do you have a sense of if this is possible? Or do you think that it depends on what the reason for, like, for example, if it opens up a critical window without the psychedelic experience, maybe that's beneficial, even if there is no psychedelic experience alongside?
Well, so this kind of takes me to a couple other points around those window periods of plasticity.
Okay.
So for one thing, there are other substances that open our windows of plasticity, again, reopens them. And that includes alcohol, cocaine, heroin. I could name some more.
Mm-hmm.
They are very, very effective at opening a window periods of plasticity. And what they do while that's open is make you want more, right? They rewire you to want more and more and more of them. Right. So, and by the way, Gull Dolan at Columbia, who did a lot of this research around the window periods of plasticity and is looking at that with psychedelics. She herself at a conference was saying in one of her talks, I'm worried that we are, with exactly what you're talking about,
right,
creating the next most addictive drugs. Right?
Because of that. Wow. Yeah.
Because of exactly that.
Wow. Yeah.
So that's part one of my answer. And part two of my answer is something I actually realized when I was speaking at the Thought Leaders Consortium for Jeff Bland, was I put together my talk, and as I'm going through all the papers beforehand, I realized that paper after paper after paper, basically in the conclusion, in the results and conclusion would say, if the person had a mystical experience, they had these outcomes, right? In other words, it was the mystical experience alongside of, or maybe even had it not been with a psychedelic, something about having the mystical experience was a really important part of recovery.
Mm-hmm.
So I don't know is my answer.
No, but I appreciate the perspective. I have heard of the critical window as well as it relates to those other drugs, but I hadn't thought about the connection without the mystical experience and having similar kinds of secondary gain kinds of potential for them as well. That's very, very interesting. Okay, so all that being said, we got derailed initially, but you did it in a great derailing sort of way. In your, what would you say, like in your de-education or whatever you say with your training, right? So it's we're uneducating or not, changing the way we think about education. So when you're thinking about educating practitioners now on how to use psychedelics, how to think about them, I know one of the things you think about is preparing the body. You and I were talking about that before we got online. So maybe we can talk about what you mean by that, and then what is the framework that you think about as a clinician when you're using these medicines or thinking about these plants in context like this?
Well, so for me, I mean, again, I just want to back up and say, people are using these. This is happening.
Right, absolutely.
And so my real interest is in making sure people that are in, right, I think we need a whole constellation of people. I don't necessarily feel like, I want to tell everyone they have to go be guides and sit with people going through an ayahuasca experience, right? No, I don't think so. What I do think is that people are going to be coming to you, their doctors, they're going to be coming to their nurse practitioners, they're going to be going to their chiropractors, they're going to be going to their pharmacists, they're going to go to their psychologists or their therapists or their nutritionists or their physical therapists, on, asking because they're coming with illness or challenges, and they're going to ask for support and guidance. And so what is legal, what is 100% legal is education.
Yes.
Yeah. And that is what I am wanting to offer, right? What then happens after that, as far as like in the state of Oregon, right, where there's going to be psychedelic, the psychedelics will be legal, and, people are going to be able to get their whole clinical experience with a guide and so on and so forth. People who, learn with me can certainly then do that, right? But my interest is in how do we create a constellation of care that kind of creates a trusted number of people who are, the leaders and the experts, for their community. And so that is my interest, and that is legal for anybody who would want that, and for me, there is real danger in opening those critical periods of plasticity, right? I mean, we can say, and I'm not going to talk smack about, whomever, but if you go to a ketamine clinic, for example, which many people do, and they give you your little, you get your ketamine and your little eye covers, and the TV is on, and you have a remote, and you could sit and watch war shows or something like that while you're opening your periods of plasticity, right? Think about this. If you have a childhood trauma, let's say, that has embedded in your cells, right, where your cell is now in defensive mode, and a cell in defensive mode is not able to be functioning optimally and in growth mode. You can't be functioning optimally if you're constantly in protection mode. And we know this looking at mitochondria and the whole spaghetti and meatballs, right? Healthy, happy optimal mitochondria are branch spaghetti shapes, and the configuration in a cell that is perceiving danger in the cell danger response is in a meatball, right? It's just like quarantine. It's not exchanging information. It's not exchanging nutrients. It's not getting rid of waste properly. So that is a cell, right? A cell's memory is going to then be in this cell danger response, is going to be in a chronic state of protection and defense rather than growth and optimal function. And so, when you're opening that period of plasticity, first of all, right, you can't be like re-traumatizing yourself. And that does happen. And it can happen even with the best support. I'm not one of those people who say there are no bad trips. No, there are. There are bad trips. And it's so gaslighting and terrible to say otherwise. Yes, we can try to make meaning of it. Yes, we can have the best support possible. That's the most important thing we can do. For me, I think a lot of the medicine in recovering from trauma is really the witnessing. It's really the ceremony. It's really the mystical, right?
Sure.
And feeling that sense of connection when we've fragmented these parts of ourselves, right? But on a physiologic level, what we're doing is going from meatball, right? Meatball mitochondria to branched spaghetti mitochondria. So when you ask me, about how do we prepare the body, well, I want to be thinking about things. And this doesn't mean, if you're advising someone going into a psychedelic journey, they have to go on a whole regimen and you have to, that's not something everyone can do, will want to do. But to be able to think about the gut microbiome, right? We know that trauma impacts the gut microbiome, and the gut microbiome is communicating with mitochondria throughout the body, right?
Of course.
Our intracellular space and like electrical superhighways. And so we want to be doing things that support the gut microbiome. We want to be supporting the diet in certain ways. We want to be supporting mitochondria in certain ways. We want to be also helping regulate people's nervous systems, like going into a big psychedelic experience with a totally dysregulated nervous system. Hello. I did that, and it's not fun, and it's not, it doesn't have to be that way. It doesn't mean, again, that everything's going to go wonderful and you're going to, see rainbows and unicorns or something like that. But it's nice to have some sense of, all those years of medical training and childhood trauma and parenting and life, like sometimes we need to do a few things, simple things that can then prepare you so that when you do reopen these periods of plasticity, whether with psychedelics or other means, and I am a fan of many different kinds of means to open these window periods of plasticity that are not necessarily things that we ingest,
sure,
that are experiential or otherwise. We want to go in with the, best outcome in mind. Like, right, what is it like? If you stay ready, you don't have to get ready, right? It's like, so like doing the things to prepare yourself, right, for something really potentially transformative.
Yeah, that's beautifully said. I mean, playing lots of sports as a kid, it was always practice like it's the game, right? Not practice just because you're practicing, right? It's the same kind of thing. And I think that where a lot of people get into trouble, the ketamine clinic next door is certainly the primary one these days, because anybody with a medical license can open up a ketamine clinic and, for the most part, and start giving IV ketamine. So I really appreciate your emphasis here on the preparation, I think. And is that so what are the major pieces of what you think is as far as framework? Obviously preparation. It sounds like nervous system support, and we're talking about microbiome. I love your spaghetti and meatballs analogy for the mitochondria, because how the mitochondria are going to react, of course, when you start opening these things up. And I think people forget that that's where we make all of our energy. That's that's all of our signaling kind of goes and comes from there. Is there anything else that you kind of think is like extremely important for a clinician to understand? I mean, obviously getting training would be helpful, but is there any other major categories that you didn't discuss?
Well, I will also mention, just in terms of the mitochondrial piece, that, I was just talking to Hemal Patel, who is a UCSD mitochondrial researcher who looked at ayahuasca administration and mitochondrial function, and found that it actually ramped up mitochondrial function in a way that would normally take like weeks or months, but in hours or days. And part of the reason for that is actually because DMT, which is in a lot of different plants, and actually we make ourselves, it's our endogenous, entheogen that we ourselves make, animals also, actually binds to a receptor called the sigma-1 receptor. I'm very nerdy about this topic, so I'm going to
do it
and check.
No, do it. It's okay. We love it.
But when DMT acts as an agonist to that sigma-1 receptor, which is a very interesting, weird receptor that doesn't really belong in any category that we exactly understand. It was thought to be an opioid, but it isn't. So we call it a pseudo-opioid receptor. But it actually activates a lot of mitochondrial activity at the junction between the endoplasmic reticulum and the mitochondria. And it's involved actually in chaperone proteins, which determine if proteins are going to be configured appropriately to be functional. So a lot of what we call diseases of civilization, right? Like Parkinson's and ALS and Alzheimer's and TBI and addiction and a number of other things. Not all of these are, modern diseases, but, many of them are related to inappropriate chaperone protein function. So what we know is that actually DMT can bind to these receptors and stimulate them. And actually, we can see very profound miraculous physical changes and sometimes recoveries because of that.
So what you're saying to me, Maya, is that I need to compound something with methylene blue, DMT, and something that keeps the DMT around long enough so that it actually has an effect when you take it orally, right?
Yeah, like maybe go chat with some the indigenous people who kind of came up with all this stuff.
Yeah, right.
Yeah, absolutely. Yeah. I mean, and again, so all of this to say that I think the other piece, right, besides, making sure people are safe when they're going through the experience itself is also afterwards, right? I'm very fascinated and interested and excited about the what now, right? You've had that mystical experience. Do you go back again and again and again? Yes, some people do, right? But for me, like just for example, it's not that I haven't had big experiences in the past, but for me, for example, I talked about that experience with the San Pedro cactus over a decade ago. I have not drunk San Pedro again since then, not because I'm scared or I won't, but because for me, I'm still unpacking that experience. And as we see, right, in my life, I wrote a book. I've, got a lot of different ways that I've been engaging with bringing master plants into the world in the best way I know how. And, as I said, kind of kicking and screaming. And that's, why people will say to me, well, Maya, that's why you're the person to talk about it.
Of course. Yeah.
I never thought I would be the person sitting on podcast with Dr. Scott Sherr talking about psychedelics and all of these topics. I just really didn't think that would be what I was doing. And yet here I am. But the what now is how do we bring the extraordinary, right? The mystical experience that we hopefully have. How do we help people bring that into the ordinary? So that, because I think a lot of what we see in people's lives, right? It's like they're living in this programming to kind of come full circle, right?
Yes.
They have a lot of unlearning that they need to do in order to be who they really are. And I always talk about kind of Clark Kent and Superman. Like Clark Kent is this guy with his tie and suit and glasses, and he looks very serious and he looks very mainstream, but he's actually very awkward and he's never really like getting the scoop. He's never really getting the girl. It's sort of like he's off, right? But then underneath that, he's actually Superman. And I think, we all have this capacity to be something more truthful for most of us than we are able to express. And I would say that even for myself, I'm not, this isn't a pat on the back, but for me, it is an unfolding journey too. I am still constantly deprogramming. I'm still like, well, should a doctor be doing this? And right.
Sure.
I still have those conversations,
Sure.
even though for a lot of people, I'm, as radical as you can be really, in the topics I discuss and what I do, I still have that deprogramming, and I think we all do. So I think that's a lot of suffering, right? That's a lot of the source of suffering for people. So, what I'm also very interested in is you open these periods of plasticity and you have this maybe mystical experience and your sensory gating is blown open in this way or cracked open, depending. And now what, right? What now? So that is the other part of the framework for me.
It's beautifully said. This has been a lot of fun, Maya. I don't want to take much more of your time. And I think that a couple things. So I do have one question for you, and I think you're going to answer this beautifully. It's something we ask all of our guests at the end of the podcast, and it's kind of straightforward, and you can take this anywhere you want to go. It's, what are the 3 ways we all can live smarter, not harder? And that's the name of the podcast. It seems kind of trite, honestly, to even ask you this question, given what we've discussed and like the profound aspects of what you're doing and the transitions that you've made in your own life and in so many people. But if you could think of maybe 3 easy things that anybody can do to help them out now, would be amazing.
So I would say the 3 things that come to mind are, number 1, spaciousness, right? That's just giving ourselves a little breathing room, not overscheduling, just being quiet, being a little bored, right? Whatever that might look like. Play. So experimenting, making mistakes, being low stakes about things, not making everything, right? Like it has to take us somewhere specific, and honoring, right? Going back to that idea, I think a big part of our purpose is actually to be in a state of wonder and awe and appreciation and gratitude. So for me, I think, that idea of honoring, whatever that might look like, is the 3rd thing.
It's beautiful. Okay. So I know you're up to a lot of different things for a lot of different people and different areas. So where can people find out more about you? And we didn't even get to your quantum drops, but certainly want to lead people in that direction as you've created this whole process of being able to be with plants in a very different way, for example. So if you can give us a little bit more about where we can find out more about you and where they can learn more. Yes.
Absolutely. So the best place to go is drmaya.com. You will find pretty much everything there. My book, The Master Plant Experience. You can find quantum drops there, or you can just go to quantumdrops.com as well, which is a legal, safe, vibrational master plant product. And also my training program, my Psychedelic Informed Practitioner training program portal, and more.
Well, thanks so much for spending some time with me today, Maya. It's good to see you. I hope we get to hang out at some point in person soon. I'm sorry I missed you in New York, but I'm sure that there'll be some random conference that's hopefully a good one that we go see each other at.
Definitely.
Okay, take care. Have a great day.
You too.
Thanks so much for listening to another episode of the Smarter Not Harder podcast, where we give you 1-cent solutions to $64,000 questions. And we had so much fun during this podcast. Dr. Shetreat and I had a tour de force talking about her life, her adventures in master plants, and how all of this can be used in clinical practice in a very real way, in a very robust way. And she says it well. People are using these medicines. We should learn how, as clinicians, to support them along that process. So check out some of Dr. Shetreat's training, check out her podcast, her website, and everything else in between. We hope you liked this. If you did, please share with your friends, like and subscribe below, and we'll see you next time on the Smarter Not Harder podcast. Take care.